Winning a money in 1 second or in 1 minute is looking just fantastic. And gambling is one of the options by making a bet or making a wager. And in a hope that you can win a lot of money that are comparable with working for all your life and even do not achieving that number of dollars or money. So it is called gambling, and everyone would like to make a bet at least one time in life, or even have this experience by looking at someone who is making a bet or is making a wager. So one time trying this and stopping at the right moment is okay, but doing this without limit and even spending all your goods by exchanging in money and put all this money by gambling or in the game can result as a losing of this money without any gaining or any of the goods for you and your life. So let's talk about compulsive gambling, or also known as gambling disorder. It is an uncontrollable urge to keep gambling despite the toll that takes all on your life. So gambling means that you are willing to risk something you value in the hope of getting something of even greater value. But most of the time it's just a hope and never achieve it as a goal. So gambling can stimulate the brain's reward system, much like drugs or alcohol can do this, that lead to addiction. Compulsive gambling is a very serious condition that can destroy lives, as spending money and destroying all your property by selling this in exchange of money. Also, treating compulsive gambling can be challenging. Many people who struggle with compulsive gambling can find help through professional treatment. How about symptoms and how to recognize them, like being preoccupied with gambling, such as constantly planning how to get more gambling money, needing to gamble with increasing amount of money to get the same thrill. So if you by chance one time you think that this work very well and trying to make more wages, so trying to control, cut back or stop gambling without success. If you want to exit this, you cannot do with any success. So feeling restless or irritable when you try to cut down on gambling. Gambling to escape problems or relieve feelings of helplessness, guilt, anxiety, and depression. Depression, as you observed, playing a great role in many of the disorders, especially psychiatry. This is a great contributor to many of them. So trying to get back lost money by gambling more. You are losing money, you are trying again with hopes that next time you will win. So chasing losses. Lying to family members or others to hide the extent of your gambling, and even jeopardizing or losing important relationships. So many of your friends are not liking this gambling. You can lose job, relationships, school or work opportunities because of gambling, and resorting to theft or fraud to get gambling money. So you don't have resources, but you want to make a bit again, and you are making something wrong activities like theft or fraud. Unlike most casual gamblers who stop when they losing or set a loss of limit. People with gambling disorder or compulsive gambling problem are compelled to keep playing to recover their money, a pattern that becomes increasingly destructive over time. So some people with compulsive gambling problem may have a remission where they gamble less or not at all for a period of time. However, without treatment, the remission usually isn't permanent. Okay, what are the risk factors that contribute to this? So, also want to mention that most people who plays cards or wagers never develop gambling never develop gambling problems. Certain factors are more often associated with compulsive gambling. So many of the risk factors that are accounted here are like mental health disorder, age, sex, family, or friend influence, medication used to treat Parkinson's disease and restless leg syndrome, certain personality characteristics, and many others that are not so important. How about mental health disorders? So people who gambling compulsively often have substance abuse problems, personality disorders, or depression and anxiety. Once again, I want to repeat that depression play a major role in any of the psychiatric disorder. Age. How about age? Compulsive gambling may also be associated with bipolar disorder, obsessive compulsive disorder, or attention deficit hyperactivity disorder. Age dependence, so compulsive gambling is more common in younger and middle-aged people. Gambling during childhood or the teenage years increases the risk of developing compulsive gambling. How about sex? It's time of sex. Compulsive gambling is more common in men than women. Women who gamble typically start later in life and may become addicted more quickly than men. So they are not trying too much, but if they are trying, it's very serious and forever. Family or friend influence. So if your family members or friends have a gambling problem, the chances are greater that you will have too, and you will enroll in this type of behavior. Medication used to treat Parkinson's disease and restless leg syndrome. Drugs called dopamine agonists have a rare side effect that may result in compulsive behavior. These drugs are given for Parkinson's disease for increasing level of dopamine, so including gambling. That's the point. Certain personality characteristics. Last point, being highly competitive or workaholic, impulsive, restless, or easily bored may increase your risk of compulsive gambling. Treatment. The most important part is treatment of compulsive gambling can be challenging because most people have a hard time admitting they have a problem. They are hiding from others this, and it's shameful as everyone is cheating you, as playing or gambling is not good for you. Yet a major component of treating is working on acknowledging that you are a compulsive gambler. You should recognize this and trying to understand the process, how it's going. So treating a gambling can help gambling problem can help you regain a sense of control, make sense of controlling this and not doing too much, and perhaps help heal damaged relationships or finances. So there is three major points of treatment like therapy, medications, and self-help groups. Therapy, behavioral therapy, or cognitive behavioral therapy may be beneficial. Behavioral therapy uses systematic exposure to the behavior you want to unlearn and teaches you skills to reduce your urge to gamble. Cognitive behavioral therapy focuses on identifying unhealthy, irrational, and negative beliefs and replaces them with healthy, positive ones. Family therapy also may be helpful. So it's teaching you that gambling is bad and how to control yourself, to recognize the problem, to recognize your urges and the times that you cannot resist of going to this casino and make a bet. So medications, antidepressants and mood stabilizers may help problems that often go along with compulsive gambling, such as depression, obsessive compulsive disorder, and attention deficit hyperactivity disorder, as I told you previously. Some antidepressants may be effective in reducing gambling behavior. Medications called narcotic antagonists, useful in treating substance abuse. Narcotic antagonists like naloxone or naltrexone may help treat compulsive gambling. Self-help groups. Some people find that talking with others who have a gambling problem may be a helpful part of treatment. So ask your healthcare professional for advice on self-help groups such as Gamblers Anonymous and other resources. At any of the point of your gambling, you can ask for help. Ask in your family if you are aware of this problem. Ask for help of your professional healthcare, of course. And the last line that is very important: coping and support. These recovery skills may help you concentrate on resisting the urges of compulsive or pathological gambling. So stay focused on your number one goal, not to gamble. Tell yourself it's too risky to gamble at all. One bet typically leads to another and another one repeated. Give yourself permissions to work for help, as sheer willpower isn't enough to overcome compulsive gambling. Ask a family member or friend to encourage you, so it's support, to follow your treatment plan. Recognize and then avoid situations that trigger your urge to bet. So if surrounding places are making you to urge and attracting you, so recognize all these places and don't go to them. Just go around and look at your way. Hope this one is useful, and thank you very much for your attention. Have a nice day.